Here we have a CT scan on 85-year-old with history of persistent headache and mild weakness in the right side. So this is a non-contrast CT which clearly shows low attenuation area in the left temporal lobe. As we progress, the edema or low attenuation is seen in the left frontal as well as left parietal lobes. This is asymmetric compared to the low attenuation area in the periventricular white matter. So we need to now look more carefully in the left cerebral hemisphere why we are having such asymmetric edema or low attenuation in the left frontoparieto-temporal lobes involving the white matter. So we need to evaluate the sulci and gyri very carefully in all cases of CT of the brain. Compared to the right side, what you can see is complete effacement of the sulci and gyri in the left frontal lobe, and we can get an impression that there is effacement of the sulci and gyri and the left cerebral hemisphere is pushed inside. And also, if you look carefully, there is minor midline shift to the right side. So based on this, the features are very likely to represent a space occupying lesion, very likely to be located in the extraaxial space. So the next best investigation would be MRI of the brain with contrast. Alternatively, we can do post-contrast CT as well to confirm the diagnosis of the extraaxial tumor. So in summary, here I wanted to show a case of an isodense extraaxial tumor, that is meningioma, which might be difficult to diagnose on non-contrast CT scans. It is important to look at the sulci and gyri and see the asymmetry on the other side to make the diagnosis.